Hi, this is Kenny, the co-founder of Aiskyra. Today's quick video is about how you can adjust how Aiskyra generates and presents its answers to your questions. So if you look at the left side navigation bar, you'll see a button that says Response Style. There are 4 of them available: Detailed Medical, Concise Medical, Point Form Medical, and Patient Friendly. Let's start with Detailed Medical. That means Aiskyra is going to provide the most comprehensive response as possible. This often means longer answers, more details, and full medical terminology. Concise Medical also uses full medical terminology, however using shorter paragraphs. Personally, I use Point Form Medical, which means the answers that Aiskyra provides are as concise as possible and also in point form. Lastly, Patient Friendly can be used for finding ways to explain complex information more simply to a patient. It can also be used to generate handouts for patients as well. Let's look at the difference between all 4 of them. I've asked the question, what are the side effects of metformin? The first answer is Detailed Medical, and you can see the answer is categorized by common adverse effects, severe adverse effects such as lactic acidosis, risk factors for lactic acidosis, symptoms of lactic acidosis, other side effects, as well as therapeutic alternatives if someone's intolerant to metformin, and then all of the references used to generate the answer. Now, if we look at Concise Medical, you can see it'll still talk about the different common adverse effects, as well as more severe, less common adverse effects, as well as therapeutic alternatives. Thirdly, if we go to Point Form Medical mode, you can see that these answers are organized in point form. Common adverse effects, serious adverse effects, any special safety considerations, as well as therapeutic alternatives. But the answers are more brief and more concise. Lastly, in Patient Friendly mode, you can see that Aiskyra has generated the answer using almost no technical language or medical terminology, and it also tries to provide an analogy and more simplistic language. It still talks about the common side effects, but also in terms of lactic acidosis, it uses an analogy to explain what it is, what's the risk, and what are the signs and symptoms to look out for. We have many clinicians who will actually use the copy button and then paste it into Word and maybe do a little bit of editing and hand it out to their patients as a customized educational piece. When you're using the response style, make sure you select the response style you want before you ask the question. You also don't need to press New Chat if you want to switch response styles within the same window. For example, in this window, I've asked the same question 4 different times. What are the side effects of metformin? And all I did was change the response style in between each of the questions. And that's it. If you have any questions, feel free to reach out to us at hello@aiskyra.com, and I'll see you at the next video. Bye.